Good day. My name is Cindy Snyder, and I'm the Advanced Clinical Genomics Nurse Practitioner at Georgia Core. And I'm here today to talk to you about hereditary breast and ovarian cancer and our breast cancer gene screen program. So at the end of the presentation, hopefully, we're going to be helping you to understand and help identify patients at risk for hereditary breast and ovarian cancer through their family history and recognize the need for screening as recommended by the U.S. Preventative Services Task Force and increase your knowledge in the use of the breast cancer gene screen tool that is now available to all health departments to use to screen people for hereditary breast and ovarian cancer. So let's get started. So all cancer is due to DNA changes or mutations that result in abnormal cell growth and reproduction, but not all cancer is hereditary. That's really important to understand. A lot of people misunderstand that and think all cancer is hereditary. Well, in fact, that's not the case. Only about 10% of the time, as best we know today, is cancer because of a hereditary cancer problem. So most cancer in the world is not hereditary, and it's an acquired problem. There is about a 20% familial pattern in cancer, and that could have something to do with a hereditary problem, but it also is related to many other factors. So let's talk about that for a minute. Breast cancer risk factors. There's a lot of risk factors for breast cancer. It's not just one thing and one thing only that causes breast cancer. If it were just one thing, I'm sure that would have got fixed a long time ago. So, developing breast cancer or cancer in general is like a puzzle with many pieces. And yes, definitely genetics plays a role in that. But there are many other pieces of the puzzle. So as we age, our risk for cancer increases. If we have a family history, our risk for cancer increases. If we're, female, we have a higher risk for breast cancer than males, although men can get breast cancer. But our hormonal status, what we're exposed to, our general health, but yes, there are the genetics to it as well. But you can still see here, there's some missing pieces of the puzzle. So that's important to understand. Now, human beings have about 20,000 genes in total. And so it's important to remember that when we're doing genetic testing for cancer, for hereditary cancer, we can't test all 20,000 genes, okay? Also, it's important to remember that you get half your genes from your mother and half your genes from your father. So it's possible to inherit a bad copy of a gene or a mutation in a gene from either or both parents. And a lot of times, people get a little bit confused when we start talking about genes and they're like, what does that mean? I don't really understand that. Well, you can really break it down and make it real simple for them by just using an analogy of genes being like a recipe in a cookbook. So the chromosomes where the genes are located is the cookbook, and the gene is the recipe in the cookbook. They make something. That's basically what we're talking about. Okay, so when we're talking to people about their family history and about genetics and cancer, just use that analogy to help them understand what genes are. The other thing that gets a little bit confusing is the names of genes. So, a lot of us have heard about BRCA1 and BRCA2, but there's all these other names of genes, CHEK2, STK11, PALB2. They're letters and numbers. It's just a name, okay? So like my name is Cindy. The name of one of those genes is PALB2, PALB2. So, and another one is like ATM. So if you just sort of think about it like that, it makes it a little bit easier to understand and helps patients sort of relate to that a little bit easier, okay? So for hereditary breast and ovarian cancer, it is an inherited tendency to develop breast and ovarian cancer at a younger age. But we talk about breast and ovarian cancer, but there are other cancers associated with hereditary breast and ovarian cancer. And some of those are fallopian tube, peritoneal, prostate, pancreatic, and ocular melanoma. There's some evidence that possibly colon cancer could be associated with a BRCA mutation, but that has not been proven to come out in the evidence so far. Among the general population, the likelihood of having a BRCA mutation is about 1 in 400. If you are a woman with breast cancer, the likelihood of that increases to about 1 in 50. If you have had breast cancer younger than age 40, again, that likelihood increases again to about 1 in 10. For men with breast cancer at any age, it's about 1 in 20. Women with ovarian cancer at any age, it's about a 10 to 15% likelihood. And people of Ashkenazi Jewish ancestry have about a 1 in 40% likelihood to have a BRCA mutation. So one of the most informative genetic tests, if you will, that we have is family history. And it's easy and cheap to find out. And knowing the family history is a way for patients to be proactive about their health and lower their risk for cancer and disease. And it can give you a lot of information about your client's risk for cancer and other disease. You know, if there's a lot of family history of diabetes or hypertension, your patient's going to be at increased risk potentially for those problems. It's also, again, it's important to know the family history from both sides of the family, mother and father side, because remember, we get half the genes from each parent. And we not only share biology with other family members, but we may also share environments and behaviors that impact our health. This diagram is an example of a patient's family history. And this was created with a program that I utilize now called CRA Health. And so when I get a referral from you for a patient, I put them in this program. And if I talk to them, I actually can quickly, while I'm talking to them, develop a family history diagram, okay? So in these diagrams, the circles represent females and the squares represent males. And the legend at the top helps to identify what the different symbols mean. So when you're looking at family history and you're developing a diagram of family history and you're trying to determine, could this be a hereditary problem, you're going to want to try to get at least 3 generations. So at least if you can get grandparents, parents, and siblings, that's 3 generations. Of course, if there's children of the patient, I'd want to know about them as well, okay? So first-degree relatives, just to help y'all remember, first-degree relatives are parents, siblings, children. Second-degree relatives, grandparents, aunts, and uncles. Third-degree relatives, cousins, great-grandparents. So when you're developing a diagram like this, what I'm looking for, okay, is a pattern. Is there a pattern of cancer over more than 1 generation? And are these cancers associated with a hereditary problem potentially? And I'm looking for red flags like young age of onset or what's their ancestry, and could that potentially associate them with an increased risk for having hereditary breast and ovarian cancer. So when you're talking to your patients about their family history, it's important to help them understand why they need to know this, okay? Because if they have a family history of breast cancer in close relatives, then they could be at increased risk for breast cancer just based on their family history. and they may need to start screening earlier than age 40, which age 40 would be women at average risk. But sometimes family members, don't want to talk about things, and it's real difficult for them to get information. But it's important, for the patient to talk to their family and try to get as much information as they can about the family history. So sometimes it helps, some tips is, let them know that why you need the information. So instead of, my grandmother had a female cancer, well, I would need to know, what does that mean, female cancer? Because there's a lot of parts below the waist, right, in women. Is that uterine? Is it ovarian? Is it cervical? Is it colon? What was it? So you want to try to get the specific type of cancer, and age at diagnosis is important, because if cancers are diagnosed at a young age, that can increase the likelihood that it's a hereditary problem, and if family members have had more than one cancer. Just reassure the patient you're just trying to get information to help, create a better picture of the patient's family history and risk for cancer and disease. And just have them, tell them, explain to your family members why you want the information. You're not trying to be nosy, but you're just trying to get as much information so you can make the best plan for yourself in terms of screening. Now, if there is a hereditary cancer problem, which this picture indicates a likelihood, because you have cancers associated with a specific gene, BRCA1 or 2, cancers being diagnosed at a young age. So you have ovarian at 40, breast at 45, and a prostate cancer here. If there is a mutation found or a pathogenic variant found in this patient, then each one of her children have a 50% chance of having the mutation. So this is what we call autosomal dominant pattern. But remember, men can also carry these pathogenic mutations, and they can pass it on to their children. So it can impact both men and women, and that's important to remember. So again, some red flags for hereditary breast and ovarian cancer is early onset or early age at diagnosis for breast cancer, ovarian cancer at any age, multiple cancers in the same person, like a woman with breast and ovarian, bilateral breast cancer, Ashkenazi Jewish ancestry. So I know I've said that about 2 or 3 times now, and I just kind of want to explain why that is. Well, because of the Ashkenazi Jewish people being, if you will, geographically separated from the rest of the world many, 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 many years ago, you had close relatives marrying close blood relatives, and they developed what's called a founder mutation within their population in the BRCA genes. And so that's why we want to know ancestry if we can get it. If there's a relative with a known BRCA pathogenic variant, that's important. Triple negative breast cancer in any woman and male breast cancer is automatically a red flag. So how does the testing process work, and how many genes do we need to test? Okay, so first off, we can do the test with saliva or blood. And at this time, most of the time, the results or the testing is going to be done with saliva. So when the patient is screened in the clinic and screens positive and completes the process and an order is submitted, a saliva kit is sent to their house. And then I follow up with them. They spit in the tube, send it back to the lab. And Myriad Genetic Laboratories is the lab we sort of work with the most, and they're located in Utah. Then it's analyzed, and then we get the results, and then I go over the results with the patient by phone. How many genes do we need to test? Well, certainly we need to test the BRCA1 and the BRCA2 genes, okay? But these days we take sort of an approach of a panel gene test. So instead of just testing 1 or 2 genes, we can test like 35 genes associated with hereditary cancer, which includes BRCA1 and 2, but other genes. So think about it like this: fishing, okay? You fish with a pole, you might catch a fish. You throw out a net, you're more likely to catch a fish. So testing multiple genes, and the panel size that we test now is about 35 genes. It's like fishing with a net. You're more likely to catch the fish. But the other side of that coin is the more genes you test, the more you could find out something that you weren't anticipating. So we, have to make sure that patients understand that, it's great that we can test more genes, but we might find out something that we weren't anticipating, like a mutation in another gene. Okay, so let's talk about the possible results that we can get. Well, since we know a lot of cancer is not a hereditary problem, we get a lot of negative results. We do get positive results, right? And so if we get a positive result, then we need to talk to the patient about that. I will contact the patient, talk to them about these results, go over it with them, help them understand what it means and how it impacts family. But there's this other part here, this inconclusive result. So what does that mean? Well, remember I said genes were like a recipe in a cookbook, right? So this inconclusive result, the way they term that on the result, is a variant of uncertain significance. So basically it's like saying, hey, I found a change in the recipe, but I don't know if it messes up the cake or makes it better, because a change in the recipe does not always mess up the cake. So a variant of unknown significance doesn't mean bad, it just means we don't know. At some point, the genetic testing lab will figure out what that means, and when they do, they'll send an amended report, hopefully to me. At that time, I'll be here, and then I'll be reaching out to the patient and to the district where the patient came from with that amended report. I can tell you that most of the time these uncertain variants get reclassified as not significant or not bad. It's just we don't always know with those right away, okay? So how do they use the information? Well, genetic testing can provide options for surgery if a patient is diagnosed with cancer and treatment with PARP inhibitors, but also if somebody who is unaffected with cancer, could help them with, knowing how better to screen for cancer. And that may include breast MRI or yearly colonoscopies, medicines that they can take to reduce their cancer risk, but also preventive surgery, mastectomy, ovaries. But another thing that's important is risk reduction with lifestyle. Whenever I talk to patients, I try to remind them of these lifestyle factors that they can use to decrease their risk, like eating a healthy diet, 5 servings of fruit and vegetables a day, limiting to no alcohol, exercise 150 minutes a week of moderate intensity exercise, and trying to be a healthy weight. Also, remember, we have laws to protect us against genetic discrimination. So this law, the Genetic Information Non-Discrimination Act, says you can't use a person's genetic information or how they're made as a pre-existing condition or for terms of employment. So jobs are not impacted, or I should say jobs are protected, health insurance is protected. But there are things that don't fall under the protection of these laws, and those specifically are life insurance, long-term care, and long-term disability. So this is the breast cancer gene screen site. This is where you go to access the tool so you can screen patients to determine if they're appropriate to be referred for genetic counseling and testing. This tool is recommended by the U.S. Preventative Services Task Force as an online screening tool that asks questions about family history to assess for hereditary cancer risk. The project was started back in 2012 to provide education to women and promote access to genetic services. It's funded by a cooperative agreement with the Georgia Department of Public Health, and it's designed to quickly identify who should be referred for genetic counseling and testing if they choose to do so. The site is available in Spanish and English, so that's important. Now, when you go to the site, this is the landing page that you will see, and it's very simple to start. You just, drop down, check your district and move through. So if there's a positive result, that means that this patient has an increased likelihood of having a hereditary cancer problem based on their family history. And then this is the person that would be referred to me by that referral form, but also given the information sheet for the Myriad Genetics Patient Education Program. And so Georgia Corps, Department of Public Health have partnered with Myriad Genetics to provide education, genetic counseling to patients. And remember, this all is no charge, okay? So that's important. And this flyer, which I have sent you to your districts, and hopefully you have these, which I can send them to you anytime, that's not a problem, is in English and in Spanish. So basically, if they screen positive, so you get a positive screen here, you go, okay, Ms. Smith, this is the patient education program that we have. It's free of charge. You can call this telephone number. First, you can watch a video by scanning the QR code. You can call the telephone number here, 888-706-0755, anytime, Monday through Friday, between the hours of 7:30 a.m. and 8 p.m., Saturday 9 to 3. And you will then talk to a certified genetic counselor for about 10 to 15 minutes. Now, patients do not need to make an appointment via this phone number. They call when they're ready to talk to somebody. And the educator will ask, what's the name of your provider's office or practice? They should tell them the Georgia Department of Public Health. Who is your ordering provider? That's me. If the patient completes the process, then I get sent an order for the genetic test, and I submit the order and follow up with the patient. If it's negative, then that means that the patient is not as likely to have a hereditary cancer problem based on their family history. But what's important is that we don't want people to think, oh, you'll never get cancer, because everybody has a risk for cancer. They do need to obviously continue to come in every year for their women's health visits. They need to be aware of their breast and keep following up as they're supposed to do. I want to go back for just a second here about the genetic testing. So if a patient is, goes through the process and I get an order on them, wanted to reassure y'all that most of the time we can get this genetic test done at no cost, because if patients are being seen in the health departments based on their income, they likely meet the criteria for financial assistance through Myriad Genetic Laboratories to get the test done at no charge. So that's something I go over with them once I receive the referral from you, okay? And I thank you for your time. This is my contact information. You can email me at any time, call me at any time. And if you have any questions, just feel free to reach out. Thank you very much, and y'all have a wonderful day.